you. It's a hard act to follow. Mark made me laugh and cry in his presentation. Before I start, I want to thank two men that are here today, Dr. Mark Lemshin for hiring me and teaching me to embrace technology. He gave me my first job, and Dr. Bob Boyd for inviting me to teach at the dental school and continuing to challenge me and mentor me. This is my family. I'm very lucky to have a very supportive husband who supports me in my career. And this is my 3-year-old daughter, Lucy, and my 8-year-old daughter, Maisie. When Maisie was 5, she told everyone, I want to be an orthodontist like my mom when I grow up. Now, after working long hours and coming home and doing Clintex till they go to bed, Maisie told me, you know what, you work too hard. I don't think I want to be an orthodontist anymore. So these are my credentials. I practice in San Francisco, about 4 blocks from the Presidio National Park on a street called Sacramento Street, and my office is on the ground floor. And this is my amazing Bella Smile team. I have Erin Schlero and Kate Farrell. We just celebrated our 10-year anniversary of opening my practice, and Dr. Lee Kimberly Mahood, who's here today, is my associate who's helped me the last 2 years. We were all minions for Halloween. We dressed Iteri, the Itero scanner, as a witch. My old scanner was a little too wide and couldn't fit into any of our costumes. Some of you may remember my husband and I last year, we were one of the few that dressed up by accident. We thought everyone would be dressed up as spies. So today I'm going to present to you Daniel. Daniel is a 24-year-old male. He came in saying, I want to close my bite. I have an extra tooth and I'm missing a lower incisor. He told me he can't eat at work. I go, what do you mean? Well, when I have lunch, I have to go eat in my cubicle because I can't bite down and eat a sandwich. You're a girl. You can eat with a fork and knife. I'm a dude. I can't have a steak sandwich and cut it up with a fork and knife and eat. So I was like, what do you mean? So looking at his facial face, you can see that Daniel has an ovoid face. He has a slight asymmetry. His lower chin deviates to the right. And when he smiles, you can see that his upper midline is deviated to the left. He has a convex profile, long lower face height. When he looked in his mouth, I realized, oh my goodness, you have a really big open bite. And look on top, he has a supernumerary tooth. Not only is 7' a supernumerary tooth, but tooth number 7 is also a peg lateral. Looking at his lower arch, he's also missing a lower incisor. Looking at the central picture, you can see his upper midline is deviated to the left. He has an 8mm open bite, and you can see the bite on the right is canted. But typically when you have a cant, the top and bottom teeth both cant in the same direction. But in his mouth, the upper cant's up and the bottom cant's down, which makes the open bite look even bigger. On the right side, the open bite's 5mm. You can see he presents with class 3 molars, class 1 canines on the right, class 3 molars, and class 2 canines on the left. He's open bite from molar to molar. He has a transverse crossbite tendency on both the right and left side as well. He also has gingival recession present on teeth 3 through 5, 12, 28, and 30. Looking at his lateral ceph, you can see that he is a skeletal class open bite. His mandibular plane angle is 42 degrees. This is clearly a surgical case. He's an A and B of 7, but it's because his mandibular plane is so steep and he grows downward, that's why he looks more class 2. Looking at his radiographs, you can see that he has some flattening of his condyles. He's missing his 3rd molars. Tooth number 22 has a slightly dilacerated root. But again, without looking at the lines, you can see he has a skeletal open bite and flared incisors. His problem list is quite extensive. He has issues in all directions. He has issues in the transverse direction, in the sagittal direction, definitely in the vertical direction. He's missing teeth. He has extra teeth. He has malformed teeth. And he has this huge tongue thrust as well. So the list of objectives is long as well. We want to level and align and treat him to ideal. What I also want to do is to take out the supernumerary tooth and bond that peg lateral to make it ideal to match the left lateral. So we presented 2 plans. Just like most doctors, I needed to present him the surgical plan. We talked about maxillary impaction, taking out the supernumerary tooth. But I also thought to myself, let's do non-surgery. Worst case scenario, I'll have to use TADS, but I'm pretty sure I think I can close this using Invisalign.
Hi, my name is Dan. A few years back, I was looking to improve my smile. As I was searching for possible places, the first few I went to, they said that I needed to get surgery or braces, and I wasn't sure if that was my only option. And she told me that she could fix my smile with just Invisalign. And I told her that, well, that's different from what everyone said, and I was a little concerned because everyone was telling me that I needed to get braces or surgery.
So I just thought, well, if everyone else says no, maybe I can try. But then I opened his ClinCheck. I was like, wow, that's a really big open bite. It looks a lot bigger when you see it in the ClinCheck. And when I do my ClinChecks for open bites, a lot of people ask me, like, what do I use? I use these really large horizontal bevel attachments on the posterior teeth for anchorage. And because he had this cant, I use those uprising optimized attachments to upright the front teeth, and I open space for the bonding for the peg laterals. So this is his progress. Aligner 21 out of 30. At tray 10, I needed to start class 3 elastics because his bite started closing, and as his mandible started rotating, he became more class 3. So I added these class 3 elastics. And at tray 17, I started utilizing a Celadent. A Celadent has been a game changer for me for closing open bites in severe hyperdivergent patients. And the reason is, and the thing I believe is because they're so steep and their jaw muscles tend to be weaker than the average person, the Celadent helps seat the aligners and helps intrude the teeth. This is him at 30 out of 30 aligners after the first set. So at this point, we scan for refinement. His upper teeth still look tipped, and the open bite has closed on the left, but it's still present on the right. So what I started to do was I bond buttons right before I scanned and had him to start wearing vertical elastics. That way I can start closing the bite while we wait 3 weeks for the trays. And then the buttons are all cut out when I get my refinement trays. And you can see here his bite's closing. It's looking better. And what I have him wear is 1/8 heavy, and I have him wear individual elastics, just like this. So he had 4 individual elastics. He wore them all the time with the aligners, and he took them out when he ate. And here he's looking much better. I'm like, oh, you're looking good, you're almost done. Well, Bella, Dr. Shen Garnett, I don't like this space right there. And I was like, what space? The little black triangles, you can still see my open bite. I think that's because you're missing a lower tooth, but I don't like it. And I go, now you've pointed it out, now I've got to fix it, because now I see it and it's starting to bother me. So I did another ClinCheck just to see, can I close that space that's bothering him? So what I did was I decided I can, because in the video when I do it in the ClinCheck Pro, I can extrude the lower incisors a little bit, do a little bit more IPR and close it. And there he finishes. So now he finishes with a slightly deeper bite, but typically when you're missing a lower incisor, you're going to finish with a deeper overbite. So he started out with an 8mm open bite, and now he's has 3 millimeters of overbite. So I closed his bite about 8 millimeters, corrected his class 3 molar relationship to class 1, got both canines class 1, gave him an ideal overjet and overbite. This is before and after. You can see that the cant has leveled out, and his smile is more balanced, and we did the bonding on his peg lateral. So what happened, right? What did we end up achieving, and how did we do it? We intruded the upper molar, and the upper incisor was extruded and retracted about 1 millimeter. The mandible rotated counterclockwise to close the bite more, just like you would do with surgery. And the lower incisor we extruded as well and retracted to help close the bite more. He was completed in 18 months, total of 21 appointments.
After 45 months of the treatment, there was also someone else that I knew that could benefit from this treatment. And he's actually here with me today. Oh.
Hello. This is Rodante. Oh my goodness, you have a twin brother? My brother looks amazing. I want to look the same. Oh my goodness, they're the same. They both have an open skeletal open bite. But he has third molars, so they're a little different. He has third molars, but he doesn't have the missing tooth. He has all his teeth, he's class 1. I was like, okay, I closed your brother's bite, I can close yours. So they shared their Acceladent and bought different mouthpieces and used it together. You can see, just like his brother, steep mandibular plane angle. And there we did, we closed his bite. Just like his brother, and he finished 1 month faster. He beat his brother by a month.
In my past relationship, she met me after my treatment, and that was one of the first things she complimented was my smile. So just hearing that, and like again, it's a boost of confidence.
We always talk, but she's always telling me that it's my smile that gets her. You know, a lot of times she would check me out in the distance, and I would smile at her. She says her part notes. So I don't know. I don't know if she's just lying or not. I see her. When I smile, she smiles, and I don't think I could have done that in the past. If I smiled, she probably smiled because it was so ugly.
So these brothers finished treatment, and when I was done, they're like, hey, Dr. Shen Garnett, guess what? I was like, what? You didn't use the TADs. I was like, oh yeah, and Justine, my financial coordinator, was like, you owe them $1,500. So they came to Vegas and spent the money. So thank you, Aaron, the Raccoon Twins, and Mike Flanagan, and my Bella Smile team for helping me take good records and helping me document all these cases. But now these boys have girlfriends and they're eating in public and their social lives have changed. Thank you.
Great. A double open bite treatment there. Can I have all 3 finalists join us on stage? For everyone, it's time to vote. Please get your cell phones out. We're going to have about 1 minute to vote. Right? Yeah, if you guys want to just stand in the order, okay. Everyone got their phones? Okay, we're going to start the clock here. So to vote for Dr. James Krause, text 495-5886 to the number 22333. To vote for Dr. Matthew McNutt, text 495-887 to 22333. To vote for Dr. Mark Lowe, text 495-888 to the number 22333. And for Dr. Shen Garnett, please text 495-889 to the number 22333. Countdown begin. Right, guys, let's cheer them on. Dr. Krause, Dr. McNutt, Dr. Mark Lowe, and Dr. Shen Garnett. And our winner is Dr. Shen Garnett for the case shootout. Woo! The trophy, take your walk of honor. What's this? All of our doctors and their patients, of course, are winners for here today. So we have beautiful plaques for each of you. And let's give our 4 finalists another great round of applause.
Beautiful for hanging out.
Good job, guys.
Thank you.
Thank you so much.